One of the most requested topics with midlife women is our skin. If you're midlife like me, you grew up Generation X probably when we used to bake in the sun. We used to lay out with the baby oil. We used to lay on the silver mats. We did tanning beds. My gosh, I used to joke that I was tan anorexic and I thought getting older would someplace so far down the road. It wasn't until I had actually a basal cell carcinoma wake up call in my mid 20s that woke me up to maybe this is not such a good idea to overdo the sun. But today, this conversation, I have a triple board certified dermatologist on, Dr. Mamina. She's got quite the following on social media, and we're going to link all of that up on the session today because you'll want to follow her for her amazing tips. But I wanted to have a really real conversation with her today about what actually works, what's just marketing, what we can do to reverse signs of aging, what we're going to have to just accept and live with, all the questions. And I also wanted to open up to all the cosmetic questions about Botox and Xeomin and fillers and lasers and just all of that we see the noise on social media about, but what actually can we do to reverse the signs of aging? So thank you so much for being here today.
Thank you so much for having me.
So let's back up for a minute. You've got, just looking at you on video, and if people are watching on YouTube, they can see you've got that perfect porcelain skin. That's what it looks like to me. And you're a dermatologist, a board certified dermatologist. I'm wondering if you got into dermatology for like trying to fix your own situation with skin, or you just were always good with your skin, or where was that background that you even started specializing in dermatology?
Yeah, I went into med school not even thinking about derm. I was very interested in like primary care. Actually, my passion, and it still is my passion, is looking at things more holistically. So not only looking at like how to diagnose and treat with prescriptions, but looking at diet, supplements, lifestyle, sleep, stress, all these other like external factors and internal factors that can play a role with health in general. And so my plan was to go into primary care and then to do like integrative or functional medicine. And it wasn't until my third year of med school when I was doing my rheumatology rotation, which was, rheumatology is a subspecialty of internal medicine. It deals with a lot of autoimmune diseases, which is something that I'm also very drawn to and intrigued by. And I saw a lot of autoimmune skin diseases when I was in my rheumatology clinic looking at patients. And I just felt so much empathy and I felt so drawn to these patients. And because it's really kind of significant how much the skin can play a role on our mental well-being and our confidence. And I could relate to that. I felt like any small thing could really affect my own confidence. And I really wanted to help these patients who had some disfiguring skin issues. And I actually chose to do med derm. So it's a combination residency with internal medicine and dermatology, because I was wondering about potentially even doing a rheumatology fellowship and focus on autoimmune skin diseases. But anyway, so I ended up doing med derm, and I like dermatology. For anyone who's not familiar, it's such a great field. You probably see a lot of like the fun stuff on social media, whether it's like the pimple popping stuff or the Botox stuff, but it is such a comprehensive medical field. You could see both adult and the pediatric population. You can do fun cosmetic things. You can really do like nerdy, like complex medical derm, whether it's autoimmune or infectious diseases. Then you also can do a little bit of surgery, which I did like surgery, but I wasn't like ready to go into the OR and manipulate bowels. I was good with just like superficial surgery. And then there's also pathology. So you have to know, every dermatologist has to know what all skin diseases look like under the microscope. Like 30% of our board exam is actually sitting at the microscope.
Wow.
And that actually reignited my love for pathology, because I also loved pathology in med school. And there's a subspecialty of dermatology called dermatopathology. And I ended up doing that as well, which is where the triple board certification came in, because it's I'm also boarded in internal medicine and dermatopathology. But I just love that you can cover so much basis with derm. And unfortunately, it's such a competitive field. And normally a lot of people know when they start med school, that's what they want to do, because you have to start like publishing, research and, getting to know like different derm departments, like both at your school and other departments, like other schools. And I just got like a late start. So I barely got into derm by the skin of my teeth. It was a very stressful process, but that's the one thing I do have to say is it is a very highly sought after field. So it is pretty competitive, but it's fun.
I love dermatology because, well, one, it interrupted my my massive problem with tanning in my early 20s because I
Ah,
had this
yes.
thing that was bleeding and it ended up being basal cell. And I'm so grateful for that because by
Yeah.
the way, when you have basal cell, to me, it looks like a little pimple that just kind of doesn't go away
Mm-hmm.
and bleeds. But I'll never forget when
Mm-hmm.
that dermatologist removed it from me, like the amount of stuff that came out with it. It was like a huge, ginormous lump that came out with it. And I thought, wow, we just see this
Mm-hmm.
little surface level, but that was what was growing under. But I'm grateful for that because that stopped me from baking in the sun. So because the sun
Yeah.
gets a lot of controversy on social media, right? And
Yes, a
I
lot.
agree that vitamin D is amazing. And I agree we
Yes.
need the sun. And I agree that we
Yes.
get dopamine from the sun. But where is the line? Because I think there's
Mm-hmm.
some dangerous information that comes out with skin aging around the sun. Where do you
Mm-hmm.
fall on that spectrum and help us with this?
Yeah, I think that's a great question because I think that things have gotten so extreme.
Mhm.
Like I think like derms have gotten really extreme about this. And then there's like this whole like other world of people who like are so scared of doctors and
Yeah.
scared of the whole system, and they think that like they need to just worship the sun and that's going to be important for their vitamin D and overall health. Yeah, and I've seen both sides and the pros and cons. So I do think that the sun plays a really important role in our health. And
Mhm.
as you alluded to, you talked about vitamin D and just like our dopamine, just our overall mental health and well-being, really huge critical role with our circadian rhythm. And that dictates
Mhm.
so much of like what the genes in our body are going to do for the whole day and at night as well. And so I do think that having some sun exposure, which is kind of crazy for a derm to say, I do
Yeah.
think having a little bit is important. And especially like in the morning, I do
Mhm.
think some, and you don't have to go crazy, like even just 10 to 15 minutes.
Mhm.
And I do still recommend wearing sunscreen, especially in the areas that do see sun all the time, like your face or the tops of your hands, the tops of your ears. You can still get vitamin D absorption through sunscreen, which
Really?
is reassuring. Vitamin D absorption and metabolism is actually more complex than we realize. I have seen patients who are out in the sun all the time. They are tan, leathery. I check their vitamin D and it's deficient. So
Wow.
it's more than just the sun. I think it has to do with your overall health and your lifestyle and like how you absorb other nutrients because other things will help vitamin D work better and absorb better in your body through your
Sure.
skin. And some of that I don't even know. It's like just more complex than I think we realize. But I do still think that the sun is such an efficient way to get vitamin D. And so yes, so I think that you can do it safely, protecting the areas at least that get chronic sun exposure and still getting some time outside. I would say if you had to find time to be outside, like I said, in the morning, you want to try to do it before
Mhm.
10 a.m. If it's in the afternoon, after 2 or 3 p.m., it's between 10 and 2 where the UV rays are the strongest. And if you have an iPhone, like you just go in the weather app and it could tell you to the UV index. Like you want to,
Mhm.
ideally, if it's like below 3, that's safe
Makes
and
sense.
better.
What about sunblock? Because so it's my understanding that mineral sunblocks are better because it sort of like bounces the sun off of you, where the chemical sunscreens, you're getting that in you. Do you have an opinion around that?
Yeah, so I know. So that's kind of the basic idea is that people think with mineral sunscreens, the rays kind of repel or yeah, bounce off.
Hmm.
Actually, both, your skin absorbs both. So you both absorb UV rays, but there is a little bit more of like a reflection off of the physical sunscreens, the zinc and the
Hmm.
titanium dioxide, the mineral sunscreens, but both technically do get absorbed. But the chemical sunscreens work with all absorption and it does get absorbed into that top layer of your skin.
Hmm.
There has been some data coming out more recently that some can get also absorbed in our bloodstream. Whether or not that is harmful is still up for debate.
Sure.
That's a whole nother controversial topic because at insanely high doses given to non-human species, it has been shown to have some issues. Not like, and this is just certain chemical sunscreen
Yeah.
ingredients, not all of them some have been shown to be potentially endocrine disruptors at unrealistic doses to humans. So, but it's the kind of thing where it's like, okay, should we still practice caution and avoid
Right.
those? And that's still a gray area because nothing has been found in humans.
Do you personally use a mineral one or do you not or do you just don't really think there's much of a difference or like what would you personally
Yeah.
do on you?
Personally, I do both mineral or hybrid mineral and chemical.
Okay.
My main reason is because I do think that having mineral, I mean, of course, there's coverage across the UVA and UVB spectrum with both mineral and chemical, but I don't know, I feel that there's a little bit better coverage with UVA with
Sure.
mineral. I think that there's some amazing chemical sunscreens that we don't have in the US, like in Europe and in Asia, that
Mhm.
have sunscreens that have really great UVA protection. So it's more just like I'm just a little bit more
Sure.
hesitant about that aspect of it. And then I would say, like, when I was pregnant, because we just don't know, like we haven't seen any harm, but because we know that there is some absorption with the chemical
Yeah,
sunscreens,
it's
I
like
just
this
stuck with,
unknown.
it's
Yeah,
this unknown. So I just like, okay, fine. I'm just gonna stick with mineral when I was pregnant, mineral
totally.
only.
So for me with the sun now, and mine's more because I've had the skin damage. I had the basal cell a few
Yeah.
times on my face there, but also the brown spots with aging, which I'm going to ask you a lot about brown
Uh-huh.
spots in a few minutes.
Sure.
But
Yeah.
so for me, when I'm outside now, I always do like the 15 minutes in the morning, like you said, and I
Uh-huh.
try to walk like after sunset or early in the morning.
Well,
But if I
yeah.
am outside during the day, for me, I wear just a big,
Mm-hmm.
huge, broad spectrum hat, so I don't have to worry. I do wear
Nice.
a mineral base sunblock on my face, and I do let my
Mm-hmm.
skin, like my actual arms, get. If it's a 20-minute walk, I don't worry about it. But if it's longer, I do also put sunblock or a long sleeve shirt to protect. I'm in
Mm-hmm.
Arizona, which is like super hot summer sun, so
Mm-hmm.
I'm cautious
Mm-hmm.
of that. What about tanning beds? Let's talk about that for a minute because that was
Mm-hmm.
a big thing in the 80s and 90s. I was so
Yeah.
guilty of that. And people get very defensive about tanning beds still. Will say that, well, they live in an area that's rainy or cold, so they feel they need it. What are your thoughts on that?
Gosh, it's the concentration is just exponentially higher. The risk of getting skin cancer is also exponentially higher with tanning beds. Like it's just not worth playing with those,
Yeah.
unfortunately. Like I
I feel like
just
that's where my
don't.
skin cancer came from, for
Yeah.
sure.
Oh, yeah.
Yeah.
It's a huge cause of like skin cancers, especially when we find skin cancers in younger people. Tanning beds
Yeah.
are huge. I mean, it's insane because I always like, ask about family history or personal history, medical history, tanning bed use, and you could just tell like
Sure.
the young people who I diagnosed skin cancer in, the majority of them have used tanning beds.
Makes
Hmm.
sense. Makes sense. Yeah, I'm completely against tanning beds, but I know if I ever make a comment, I get
Hmm.
the hit of, well, I live in an area and I need the sun, so I don't know what the solution is,
I
but
know
but
that
not those.
there's like lights because there's areas where, yeah, it's like dark for a long period of
Hmm.
time. And I think there's just like those like high lumen lights that you could have like turn on in the morning and stuff. But yeah,
But work around
don't
other
get
than
UV
tanning beds.
rays.
Yeah.
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 What about reversing damage here? I want to talk about brown
Hmm.
spots specifically because that is my nemesis. I can't stand that I
Hmm.
have so
Hmm.
many brown spots. I think I've sort of won the battle on my face. I use great
Hmm.
products and I've done IPL and all that. My body
Ah,
is another
yeah.
story. I don't know how to get rid of them.
Oh,
What can we actually do for brown spots? Is there really a treatment? And when we look at some of these ads for these companies with like hydroquinone, I don't even know if I'm pronouncing it right. I've heard those are
yes.
highly toxic and dangerous. So help us understand this.
Yes. So, okay, you did mention earlier that you will let your arms get exposed just for like 20 minutes. If it's
Hmm.
longer, you cover them. I do think that honestly, any little bit of exposure, is if it's during, especially those peak hours,
Okay.
it does accumulate over time. So,
Wow.
like even like 5 minutes a day, it does accumulate. So, if you're concerned about
Yep.
sun damage and skin cancers, if you have like a low risk for skin cancer and you don't mind like, getting sunspots or wrinkles, then I'd be like, okay, you don't have to go crazy with the sun
Hmm.
protection. But yes, if that's something, if you're concerned about brown spots and of course preventing skin
Yep.
cancer, I would even, yeah,
Okay.
if it's during that time,
Yep.
I would
Makes
I would
sense.
try to make sure those protected. So that's the first step, is like sun protection, because if you're not
Hmm.
protecting your skin, it's like one step forward, one step back, like with these
Yes.
other procedures and things. But yes, there's a few different things, and you brought up a topical ingredient, hydroquinone. So there's topical, then there's like procedures. So with topical ingredients, I would say the main workhorse prescription ingredient is hydroquinone, but it is something that we do not want people using long term. Now,
Hmm.
for a couple reasons. There's a couple of aspects. One, you mentioned that, is it toxic? I know that it's something we don't recommend during pregnancy or even breastfeeding. There was like one small study, and I can't remember off the top of my head, that it could
Hmm.
even potentially increase the risk of skin cancer or some
Hmm.
other cancer. And I wish I knew off exactly what it is. So we don't like people using it on large surface areas. If you're trying to
Yeah.
work on like a few spots, like on your face, it's fine. But we also want people taking breaks from it because people who
Yeah.
use it long term, it can actually paradoxically darken the skin in a
Wow.
very, yeah, it's very rare. So I don't want to like cause fear. And a lot of times it's riskier if you use a higher concentration than the standard prescription, because a lot of times we compound it to do something stronger than the 4% standard prescription that you can get.
Hmm.
So the risk is higher with higher percentages. And the risk is higher if you do have a darker skin tone as well.
Hmm.
If you do have more melanin that the hydroquinone can like interact with. So I would just say like, yeah, even though it's a great skin lightening and skin brightening cream, I
Yeah.
would not rely on it. Another ingredient that I think should be like a workhorse staple in people's regimen for brown spots on their arms and of course for their
Hmm.
face. By the way, your skin looks amazing. So
Thank
you're
you.
you're doing a great job. But like using a retinoid, that's going to help with multiple aspects of your skin. So there's over-the-counter retinol, which it's the inactive form of
Hmm.
like prescription retinoid like tretinoin, so it doesn't work as fast. It can still of course help, but I'm a big fan of tretinoin, and that over time it increases your skin cell turnover, so it helps kind of get even out your skin tone. It's getting kind of rid of kind of the
Yeah.
older darker cells that are more sun damaged and evening out your skin. And then it's also working deeper on the collagen level to remodel collagen, help kind of renew collagen, and that will help with fine lines and wrinkles and crepiness. So it's doing a lot of different things, and so I think that's
Yeah.
important.
Yeah.
And then
And I don't want people to
mhm,
base on me, but I will share that
mhm,
I stopped using both those things. I'll tell you why. Because I
mhm,
do my blood work every 90 days. And I understand I can't completely eliminate toxic load. Like we're exposed to toxins all the time.
it's
But
hard.
my liver numbers went way up when I was using both of those. And I thought, okay, this is interesting.
It
So, and
is
I
interesting.
tested that and noticed it a few times. So I personally stopped using both of those. Now, whether that just meant my liver was doing what it's supposed to do and it's getting rid of anything extra or was coincidental,
Hmm.
I don't know.
Hmm.
But two things I started doing, and I wanted to ask you about these, is I
Hmm.
started using an estrogen cream on my face.
Hmm.
Um,
I love that.
and a topical peptide. So I wanted to ask
Uh-huh.
mostly about the estrogen
Yes.
cream because women are going to
Yes.
ask about this. Yes.
Oh yeah, yeah. So yeah, we can get into the wrinkle space. There's a few
Yeah.
more ingredients that can help with brown
Oh,
spots.
let's finish that first
You
then,
want
and
to
then
do
we'll talk
that?
about
Okay.
wrinkles. Yeah. Keep going
Okay,
on the
okay, yes.
brown.
But no, yeah, there's so many fun things.
Okay.
So for brown spots, so I think that's interesting. I don't know which it could be from. I could see it potentially being from tretinoin though, because the oral
Yeah.
form can affect the liver. But there's of course other things that can help brighten dark spots. I think regular exfoliation is important. So there's like
Okay.
over the counter like AHAs, like glycolic acid, lactic acid, malic acid, and there's stronger concentrations that you can get over the counter, 10 to 20% like glycolic
Okay.
acid, that you can do like once a
Wow.
week. That can make a big difference. And then of course you could do chemical peels in the office, and we'll talk about office procedures. But there's other skin lightening ingredients that are incorporated in skin lightening serums that you can use. Vitamin C can help, tranexamic acid topically, alpha arbutin, niacinamide, azelaic acid. Though there's options if you cannot
Okay.
tolerate some of these like stronger like prescriptions that I mentioned earlier.
Makes sense.
Yes, so doing that, and then I mentioned chemical peels. I think that's
Hmm.
a great, I love that actually for the arms and the
And
hands
that'll work
in
on the
office.
arms. I never even knew that you could do that.
You can. It depends on like how extensive the brown spots are. Sometimes it's maybe
Hmm.
like a lot of work that you may not, because it's like doing a lot of chemical peels. And then like I think kind of hitting it from different angles. If it's very extensive, chemical peels, and also doing lasers as well,
Yes.
like whether
And
it's
even with the laser,
IPL.
though, it can come back,
It can
right? I
come
mean,
back.
that's,
I
I
know, like
noticed
you
I did
have
that
to.
Alessandra, is it the Alexandra laser? And on like
Uh-huh.
made
Yeah.
myself like scab up everything and then they all came right
Yeah,
back.
yeah. Oh, yeah. So it's hard. Like you have to like have a really good skin regimen and be super, super strict. And I'm also a huge fan of like sun protective clothing, because it is hard to like put sunscreen on your arms
Yeah.
every day. Like I have like a very lightweight hoodie, UV protective hoodie, UPF, that I always put on before I get in my car to
Smart.
drive. And it like covers the hands a little bit too. It has like the holes for the
Oh,
hands.
even in the car with the
Um,
window. Yeah. Wow.
Yes, yes. So UVA rays still penetrate window glass. And I think that's a huge cause of like the arm spots that I
Oh,
see, the easy bruising and the brown spots. So
wow.
I'm all about like either driving gloves, which they make some cute ones now, and then or just like a lightweight UPF hoodie that
Yeah.
you could just like easily pop on. Because I don't recommend keeping sunscreen in your car, just because like if your car is in a high temperature area, it'll like mess up the sunscreen.
Totally.
But yes, so that's for
By
brown
the way,
spots on the
anyone
arm.
listening that might be rolling their eyes at this, like, well, that's excessive, or I want this. like that's like my husband. I'm like, go for it then.
Yeah.
But if you
Yeah,
want
go for it.
skin that doesn't have the brown spots and the wrinkles, we got to look at all this. I mean, I care about
Exactly.
that. I do. Like,
Yeah, yeah, yeah. Exactly. Like, of course, if you're not into it, like totally fine. Like
yeah,
you
like
can
my
live with
husband,
brown
he's
spots.
doesn't care. He's like, whatever, brown spot,
Yeah.
wrinkle, whatever, character.
Yeah.
That's it. I'm like, I
Yeah.
don't want that. So if I'm hearing you correctly, the kind of the big ones are the hydroquinone, tretinoin. Those are prescriptions. That's
Hmm.
questionable, like if you tolerate or you don't tolerate, but that would definitely
Exactly.
works. If you can't do
Hmm.
that, there's lots of other ingredients that you can ask your dermatologist about that will help. And then
Yes.
chemical peels are kind of like that next level, or the lasers that you can do. I'm a fan of
Yes.
IPL lasers. Have you ever done that? I've done IPL on my laser on my face probably twice a year for
Yeah.
several
Yeah. I
years
like
now.
IPL. We actually don't carry IPL, but I think that it is a helpful laser. I'm a big fan of Fraxel, which is what
Hmm.
we have in our
The
office. It's
resurfacing.
yes, non-ablative resurfacing. I think there is a little bit more of a downtime, so that's more annoying than IPL, but yeah, so it depends on like, whether you're ready to have that downtime to go
Yep.
for it. Otherwise, like IPLs, I think are really great for people who haven't been exposed to lasers yet and they just want to like start with something. I think that it's
Yeah.
effective for
It
brown
doesn't feel
spots.
good, by the way, warning. It hurts.
Yeah,
It's like
yeah,
it feels
yeah.
like someone's taking a lighter on your
Yeah.
face.
Uh-huh.
But it does not work for melasma, but it'll work for sun spots.
Yes.
I
For
figured that out.
sunspots.
If you have
Yes,
I have a
yes.
melasma spot that it won't get rid of. So
Yes. You want to, yeah, make sure that you go to somebody who can also make sure they can differentiate between the
yes.
two. I do not like lasers for melasma. I mean, maybe the pico laser, which is more specific for brown spots, but yeah, just the heat too can make melasma
Yeah.
worse.
And that's what
So
happened and I love my dermatologist, but he did not, because we just assumed it was like all the other ones. And I have this one that we
mm,
kept going after and it just got worse. And it's because
mm, mm.
it's probably hormone
Melasma.
changes and
Yeah, yeah,
melasma.
yeah.
Let's talk
Yeah.
about the wrinkles and the fine lines.
Yes, yes.
And there's lots of options here. I want to start with kind of the topical stuff that we can do, like, and then I want to talk about injectables and then all the different options here.
Hmm.
So I just recently, in the last 3 months, I added a topical peptide and I added the estrogen cream.
Nice.
And
Love it.
it's estriol, I think, mixed with
Estriol. Yep.
estriol mixed with hyaluronic acid, I believe is
Nice.
the compounding that I did. How do you feel about that?
I am a fan. I know
Mm.
like some people are like a little bit concerned about topical estrogen or like even just estrogen in general as a like a hormone replacement thing. I think that the amount that's used is very little
Hmm.
and I think that the impact it can have is so great. So I'm definitely a fan. I think that I love it for areas where the skin is especially thin, like around the eyes.
Hmm.
And I love it like if people starting to notice like a little bit of wrinkles like around their mouth. And then
Yeah.
like I love it for the neck too, where like people can start to really notice early the signs of crepiness.
Totally.
Yeah,
Totally. Okay. So,
yeah.
and you get that from your doctor. You would have to get it compounded,
Yes, it would have to be
or
compounded
you
and
can
not
use your
all
vaginal
derms.
one off label if you
Right, right,
want.
right. If you have
Yes.
that.
That's how I
Hmm.
started.
Hmm.
That's how I started with
Hmm.
mine. But you can get it from a compounding pharmacy, which I think is great. You can use it with your other
Hmm.
skincare stuff, which is amazing. Let's talk about
Yes.
injectables. Lots of controversy
Yeah.
over that. And I want to share just sort of my journey real quick too, because people are going to ask me because I share everything on social media. So for
Yeah.
years ago, I would do Botox every now and then. And I stopped doing Botox specifically because it really did some crazy things to my eyebrows. Like for whatever, I have a very strong brow and it was like, and I
Hmm.
also had a scar when I was a kid. I had a little tumor removed when I was a kid. So
Uh-huh.
something opposite happens on my brow. So I just was like, I'm
Yeah.
done with Botox. And then I would get
Yeah.
comments on social all the time because I had lines in my forehead and it would say like, you have bad Botox. I'm like, no, I don't have it. Just everyone's used to people having Botox. So I stood out as not
Yeah.
having it.
Oh.
So, I'm self-conscious about all that and I understand the risk with Botox. So I tried something maybe several months ago called Xeomin, which is supposed to be a
Hmm.
more
Hmm.
natural option. And I did way
Hmm.
less, like just a little bit, which just kind of took the edge off of things without giving me the
Yeah.
crazy. So I wanted to ask
Yeah.
you about, first of all, how much risk is there really with Botox? Like how dangerous is it really? Or is this something
Hmm.
people have blown out of proportion? And then how much
Hmm.
better is Xeomin? Or is that just a
Hmm.
marketing thing?
Yeah, I think I know this is a very like people are so interested in this topic. I think that overall, despite the name botulinum toxin, which is what all
Mhm.
these are, Botox, Dysport, Xeomin, they're
Mhm.
all brands of botulinum toxin. inert
Okay.
and synthetic. It's not, you're not going to get like botulinum poisoning from it or anything like that. The main risk is, and it's fraction of a percentage. Like
Hmm.
once again, I shouldn't even give a number because I don't even know, but like it's a decimal, like
Okay.
could be 0.01% of people like can get an allergic reaction to it, like a systemic allergic
Yeah.
reaction. I have not seen that, knock on wood, but that can happen with anything. We see it way more with like vaccines. I mean, vaccines are eliciting immune
Sure.
response, and I think that vaccines are important, but I do think we see way less issues with something like Botox. When I say Botox,
So
I'm
you're saying
referring
like
to
just the
all the
same way someone could have a
neurotoxins.
reaction to a vaccine, you're saying that
Yes,
could happen with
could
Botox, but
happen.
it's like a
Yeah, but way less likely.
okay.
Way less likely. And the main complications, it's kind of like what you were alluding to, is if it's misplaced, and everyone's
Hmm.
anatomy is different too. So you can't do Botox the same way in everyone, of course. And of
Hmm.
course, the amounts have to be different too, depending on the person and their muscle and their muscular anatomy. But the main issue with Botox is like asymmetry. If like one side does not pick it up as well, or if the provider did not put it in, correctly, or if it migrated to one
Yeah.
area more so. That would be potentially the main issue. And then bruising. But toxicity wise, like I feel like I've heard a couple of stories like online of
I
people
mean, I can
talking
definitely find
about,
stories on TikTok, and I don't want to dismiss those
yeah,
people. I'm sure
of
that that's real
course.
for
Yeah,
them.
yeah, yeah. And
But
that's something I want to
yeah,
actually I want to learn more about, because that's not something that we see as derms often,
sure.
nor is it something that we're taught to. But like I saw an Instagram like support group like about it, and I was like, I want to hear more, because but I mean I inject it like
Yeah.
hundreds of times a week in people, and people are obsessed and they love it. In terms of Botox versus something like Xeomin, they're both botulinum toxin. Xeomin is a smaller protein,
Okay.
so there's like less surface area, less protein substance for your body to react to
Mm.
potentially, because your body can still create like an immune response.
So it's kind of like having a cookie like made with healthier ingredients or not healthy ingredients. It's still a cookie, still
It's
not
still a
the
cookie. Yeah, yeah,
ideal. It just
yeah.
might be a next
Yeah.
like level up.
Yeah,
That's what I'm hearing.
I think that if you are concerned about like the effects of neurotoxin, maybe Xeomin would be like the one to start with. And I like that also you were getting a lower amount.
I got
I do
very low. Like just I
good.
was like, I don't want my forehead not to move. I was like, let me just see if we can
Yeah.
just play with a little bit so it just softens it. And
Yeah, it just softens, just takes the edge off a little bit. And that's my approach actually with most patients, is I don't like freezing. Unless they
Mhm.
like specifically request for it. But I do think that I have seen like over time some people even develop like a tolerance, like people who've been doing it for decades.
Sure.
And so I just think that like just you don't have to overdo it. Just do a little
Yeah.
bit, and just do it like 2 or 3 times a
Because I
year,
always
if
joke, I'm like,
that.
we just look like 50-year-old women with Botox then. We don't look like 30 all
Right.
of a sudden. It's like,
Right,
so,
right,
so
right.
I think like, what's my goal with some things, like what is
Yeah.
the goal? People really were in an uproar with me doing anything because I had an explant. So I had breast implants removed, and I talked a lot about reducing toxic load, which I meant like, but
Yeah,
I
yeah,
never claimed to say I was going all like 100% granola. Like I never said that. So it's
yeah,
when I share these little things that I have tried or done, it's like somebody will go, well, I thought you were going all, I never said that. So for the record, I never said I'm going all natural. I said that I'm reducing toxic load and looking for better
yeah.
options
And I
for
think that's like
me.
the realistic way of doing it, because sometimes it's impossible. We
Mhm.
are inundated,
Yeah. Okay.
and
Talk
we
to me
also,
about
yeah,
like Japanese face taping and like some of these
yeah,
products. I tried those frowny things for me. They just smelled and didn't
hmm,
do anything for me. I've tried
yeah.
like the facial massage. I've tried gua sha. Like how much do you think some of this really makes a difference, or like it gets confusing?
So I think that there's definitely a role for these, and
Okay.
I will tell you which ones I use. I don't think anything replaces the effects of Botox or Xeomin, but I do think that they could be helpful, especially if you do not want to use the Botox or Xeomin route. The frownies and the face tape. So, okay, interestingly, I've never tried the Japanese face tape. I'm very
Okay.
intrigued as to how that is different from some of the other adhesive
Hmm.
face patches that we already have. But the concept basically is we also still make expressions at night.
Okay.
And I think that by using these adhesive patches, it can help minimize that. Like I said, it does not compare to Botox, but where I do find it to be helpful, that's something that Botox cannot fix,
Mm-hmm.
are for people who are side sleepers, and chronic side sleepers can get these diagonal lines in their forehead
Okay.
that go like this. And then they could also get lines in their chest.
Mm.
And those are just literally because of the
Yep.
way your face is smashed on the pillow, or the way that your chest is like kind of curved. And so that's where I do think those patches can be helpful more so
Mm-hmm.
than like Botox or Dysport. But yeah, so the same thing goes with the Japanese face tape. I'm intrigued by the Japanese face tape because it sounds like it's more effective. So I'm going to honestly try to get my
Okay.
hands on some of it because I'm personally very
Curious.
curious. But I think it is something that people can think about if they're not into
So,
Botox or Dysport. I've tried like the Frownies. I think the brand was SIO.
mm-hmm.
And like it just, to me, is not comfortable. Like
And they
when I
smell.
sleep. Do they
I mean, I'm
smell?
willing
I
to
didn't
try it
even.
again, but it felt like
Oh,
I had paste on my, I was like, this isn't working for me. I didn't, it
oh,
wasn't,
oh. Yeah, no,
yeah.
it just felt like too uncomfortable. Like I didn't
Yeah.
want all that stuff on my face while I was sleeping. But that is an option. I am a fan of like facial massage and gua sha, just like I'm a fan of like massage for the body. Things can accumulate and build up. And
Mm-hmm.
we do like exercise our bodies. We may not exercise our face, and like some areas may not move unless they're like physically manipulated.
Right.
And so fluid can build up. And this is not talked about by derms at all. This is like just my own personal
Yeah.
belief.
That's what I wanted to hear. Yeah.
Yeah, and I do think facial massage, I think gua sha is helpful. You don't have to get a gua sha tool, but I think it makes things easier than
So
using
help
your
me understand that.
fingers.
Okay, so this is where
Hmm.
my brain goes and I get a little confused. So I'm sure someone listening is confused too. So if you think
Hmm.
about like if you do Botox, okay, I'm talking about your forehead for a minute.
Hmm.
It freezes the muscle. So you stop getting the lines because you've frozen the muscle. But the
Hmm.
thought
Hmm.
process on doing like some facial massage and deep work is to activate that muscle so you don't have the droop and the aging and the changes. But aren't those kind of they're like opposite approaches. So one's
My
freezing and one's moving. So it's confusing to me.
Yeah. Well, when you're moving the muscle, it's more just you're not moving it the way that you're moving it with the facial
Okay.
expressions. You're just sort of almost just like stimulating the muscle so that like blood is flowing through it and it's able to just help with circulation in your skin. So I think that's the main difference. It's like you're not massaging it so that it's creating the same
Okay.
wrinkles that you were with the expression. And then I think just massaging and doing gua sha is helpful because you also need muscle movement to help with like the circulation in your face, like I
Okay.
just mentioned. And you actually is theoretically, you're not really getting that. There's like a little bit less of that if you are getting Botox. So I think all
Yeah.
the more reason to just help boost the circulation by like doing facial massage. Like I said, it's not the same type of muscle movement as like making expressions. So
Sure.
you're not making those kinds of wrinkles. And yeah, and just like helping just to move fluid in your
Okay.
face.
So you can do it even if you have Botox in your face. If I'm hearing you correctly, you can do gua sha even with that.
You can. I would, to be on the safe side, I definitely wouldn't do it for the first 24 to 48 hours after using it. And
Okay.
if anything, I would probably even wait like a week just to make sure that the Botox or the Dysport or Xeomin is completely like
Because you don't
settled
want to
into your
move it.
face.
Yes.
Correct. Yes, yes. And the movement's the greatest in the first 6 hours after you get the injection. But we just tell people, I mean, I tell people the first 24
Yeah.
hours for sure. Don't get like a massage or yeah, don't
Makes sense.
exercise.
What about upper lip lines, the vertical lines?
Yes. Oh my gosh. Okay. Yes. Those are one of the hardest lines to treat. So I would say to tackle that early, like if you're prone to them, genetics plays a really big role for
Yep,
those.
I
But
am.
I tell patients it takes a village in terms of how to treat those. It's hitting it from different angles. I think in terms of like first of all, just like preventative measures to minimize drinking with a straw,
Hmm.
as I know, like making a straw makes drinking so much easier. But anyways, minimizing straw, of course, don't smoke. And then procedures that are done, you can get Botox. We only do a little bit. I do max 4 units above, and if they want to do below, I'll do max 4 units below. Because if you go beyond that, like you won't be able to pronounce certain words, you won't be able to
Yeah.
like eat properly. So very conservative with that. And that definitely helps. But if you have really deep wrinkles, that's only going to take you so far.
Mhm.
I do think that fillers can play a role. We use very fine fillers. So, the ones that are more lightweight, like Restylane Refine,
Mhm.
Juvederm Ultra can work. And then, or like Volbella, Juvederm Volbella. And then RHA is another brand, RHA. The is it RHA5? That's just a fine
And you
filler.
inject right in the
You
line
can
if you do that.
literally go right into the lines. Those are better for people with like deeper lines.
Okay.
So there's filler. And then I also recommend microneedling. I love microneedling, by the way.
Hmm.
It's like a great just helping tighten the skin, helping with fine lines and wrinkles throughout the
Okay.
face, especially also if you don't want to do Botox or Xeomin. I'm a big fan of microneedling, especially with
Like
PRP,
with
which is
PRP or PRF or
yeah,
okay.
yeah, or PRF. We don't do PRF in our office. I want
Hmm.
to, but anyways, we're sticking with PRP right now. But
Which, by the way,
so
that's platelet-rich plasma, where you draw
platelet-rich
your own
plasma.
blood, they spin it down in a
Yes.
centrifuge, and then so it's your own body fluid basically getting
Yeah.
injected back in or put back
Yes.
in with the
Put back
microneedling little
in.
holes.
Yeah. Also, another controversial thing that people, I mean, it's controversial because some derms are so anti it. I'm more open to it, though we haven't done it in our office. But with microneedling, you could also do exosomes instead
Hmm.
of PRP because these all contain growth factors that help stimulate collagen production. But, anyways, getting back to lip lines, microneedling with or without PRP or exosomes. And then like the fourth thing I recommend is lasers, like the Fraxel laser,
Okay.
a non-ablative laser. And yeah, hitting, like I said, it takes a village hitting it
I
from different
just had
angles.
CO2 laser under my eyes, and I so wish I
Oh,
had done it above my lip at the same time. I didn't,
oh,
but I wish
yeah.
I had because I don't want to go through it again. But it was like
It's
that would
such
have
a
been nice to
pain.
do at the same
Yeah.
time. No, I've
Mm-hmm.
not done any filler actually, believe it. Like that's one thing I've stayed away from, and it scares
Mm-hmm.
me. And I'll tell you why. And I'm curious how much of
Of
truth there is to
course.
this. I think as we age and our face kind of changes shape, what I notice, at least in my on my friends that are in their 50s and have filler, is it just starts looking like this stuff on top of sagging. So it might look good on somebody in
Mm-hmm.
their 30s, and then somehow like late 40s,
Mm-hmm.
50s, it starts looking funny. And then I've
Mm-hmm.
heard that it can migrate, that it can move, and two, that it never fully
Mm-hmm.
goes away. Is that true?
Hmm. Yeah, all those things can be true. It's not the case for everyone. And yeah, I definitely think that we see more of those issues in people who get a lot of filler.
Okay.
So I would definitely, because it's one of those things like when you get it the first time, and if you just get a little bit, you're like, oh wow, okay.
Yeah.
And when they see that, they think, okay, more is better.
Like eyelashes and
And
boobs. That was what we did.
exactly,
I've seen that
yeah.
trend with that too.
Oh my
So
gosh, yeah.
like a little lash, and next thing you know, we've got
Oh
tarantulas.
my gosh,
Yeah.
we got exactly. And so there's a little bit of like facial dysmorphia or like body dysmorphia coming into
Hmm.
play too. And it's not just the person getting it. I think the injector is also responsible for this whole
Okay.
process too. But yes, typically if that does happen, which I feel like more and more people are talking about it. And so I think it's becoming more common. I think it's because people are getting a lot of filler. And I think there's this movement now for people like opting out of filler or getting less filler. And we're seeing in studies more and more that like filler is lasting longer than the 9 months to a year and a half that
Mm.
we thought in the initial studies and in our patients. And so, especially in areas where it's injected where you're not moving so much. So, like if filler is injected under the eyes, like we're not like
Yep.
moving those muscles, like so we're seeing those hang around longer as opposed to like around the mouth where people are like
Totally.
talking more, that gets metabolized faster. So but yeah, I think it's still a little bit of a controversial subject, but I definitely think migration is possible.
With lips, I
And
see that all the time on people where
oh, for
it starts
sure.
looking like a duck lip.
Yeah, definitely. I'm like, oh, with the lips, I always do such a small amount because that can,
Yeah.
yeah, that can definitely make or break
And they're just kind of warning to
appearance.
anyone listening, if you ever want to do surgery, you have to dissolve all that anyway. Like you can't get optimal like facelift or even anything if you've got filler right there. They can't really see what's going on.
Yeah, it definitely makes things harder for the surgeon for sure, especially if you do Sculptra, like that class of fillers,
Yeah.
Radius, where that's actually more of a permanent filler.
Okay.
And basically, I was hearing a plastic surgeon talk about it. Like it's almost like putting glue between the pages if you're doing like Sculptra. So it's like
Oh,
so hard
wow.
to go between the
Oh,
layers of the
wow.
skin. So it makes surgery down the line so much more
Yeah.
difficult,
I personally I
FYI.
mean, I was very public with this recently. I had I did at the same time of the CO2 laser, I did upper eye bleph, lower, and a fat transfer. So I'm a fan of
Nice.
surgical more than I am like
Uh-huh.
some
Uh-huh.
injectables for that, just because to me, it's more, I mean, nothing's permanent. We're going to still age, but it sounds more invasive, but it's actually less over time because you're just
Mm-hmm.
fixing and
Mm-hmm.
reversing versus injecting. So
Mm-hmm. Mm-hmm.
that was my
Mm-hmm.
preference on that.
Yeah.
What about these are just some random weird questions I wanted to ask you, and these are all from social
Please.
media
I love
because like
it.
I get these weird things from TikTok or Instagram, and I have to ask like
Yeah.
I now hear that you're not supposed to wash your face twice a day. You're only supposed to, what do you, is that baloney? Is there a reason?
Yeah, it's person dependent.
Okay.
You definitely don't want to overdo washing your face. It depends on your skin type as well and like what you have on your face. But yeah, and a lot of it also depends on the cleanser too. Some cleansers are like super gentle and moisturizing and like would be
Mhm.
fine to use twice a
Okay.
day. You definitely want to wash your face at night. You want to wash off like all the exposure that you had of all the elements of the day,
Hmm.
whether it is pollutants, makeup, sunscreen, all that stuff. So that's really important. In the morning, in terms of whether or not you should wash your face, I mean, I think it's still important to at least rinse your face with water. But I would say you can wash your face if you have like really oily or acne prone
Hmm.
skin and you want to wash off like any of the heavy products you used. If you use like a heavier
Yeah.
moisturizer or something, you just want to like clear your face and like have a fresh template for the next skincare products.
Yeah.
Because if you're using acne treatment also in the morning, because some acne treatments are twice a day, like you want to clear off what's
Makes
there.
sense. I wash
So
in the
there's
morning because I use a
exceptions.
red light every day and I want like nothing on my skin when I go sit in front of
Oh,
the red
yeah.
light. So it's like
Yeah,
the
yeah,
first thing
yeah.
I'll do is wash it and then go sit in
Hmm.
front of the
Hmm.
red light for me.
Yeah. There's so much nuance. Like when I see all these like statements,
Yeah.
like it's like, sure, yeah, okay, it's good to just wash your face once a day, but there's more to it than
Right.
that. But
That
yes, in
brings
your
me to
case,
makeup wipes. Same thing. What
uh-huh.
people really hate on makeup wipes, but they really help remove your
Yeah.
mascara. So how bad are
Yeah.
those?
Yeah. Yeah. I think there's multiple aspects to makeup wipes. I think that they're okay if you don't have access to like a topical makeup remover, micellar water, or like a cleansing oil that does also
Mhm.
can do a really good job at eye makeup. Makeup wipes are good. Like they're convenient because they're just
Yeah.
like kind of like less messy to deal with. I think the issues that we see with makeup wipes as derms, certain preservatives have to be used to like keep the makeup wipes fresh.
Mm,
And sometimes people can get like a contact allergy to those, like
okay.
contact dermatitis. So they can potentially be more irritating than other cleansing agents for makeup. And the other thing can be like just more of an environmental issue. Like, oh, is it wasteful that you're
Yeah.
using like these cloths every day? But I would say like it's always good to have like a little makeup, a pack of
Yeah.
makeup wipes at your nightstand for those days where you're just like, I can't do anything. But like if you could at least just remove your
Just
makeup,
wipe that off. Yeah.
please, like
I keep them
you'll
in
thank
two
yourself.
places. I keep them, well, I use them for if I have a lot of eye makeup on, I'll use it first before I wash my face. That's because if I use the oil, it just, I don't know, it doesn't to me. I've done that. I've done both, but that's when and then I also
Yeah.
use them. I keep them in my gym bag because if I'm going to go like
Hmm.
hike or do something sweaty, like I might want to just quickly wipe off. So that's
For
the two
sure.
times that I really like them.
Yeah. And if it doesn't irritate your skin and that works for you, then that's
Yeah.
great.
It's funny because I had a video before my eye surgery on social media that went kind of viral, but it
Yeah.
started with me using makeup wipes and the amount of
Oh,
comments
yeah.
of
Oh my
like,
gosh.
you're destroying your skin. I was like,
Oh my
okay.
gosh. I
Yeah.
know there's so much nuance to that. But yes. Yes.
Yeah. So, and then my final question, which is really nothing with
Hmm.
cosmetic, but it's how often do you recommend people do a full body skin check in our age group?
Yes. Yes. So that is also person dependent. I
Okay.
do think that if you have not seen a dermatologist and gotten a full body skin check, you can do that no matter your age, no matter your history or your skin
Hmm.
type, your demographic. And then once you're in the derm office, they can determine how often you need to get one.
Okay.
For people who usually need to get one yearly, they usually, of course, if you've had a personal or family history of skin cancer, namely melanoma, melanoma is
Yeah.
more so genetic
And that's
than the
that's the really dangerous
non-melanoma. That's
one.
the
That's
dangerous one.
yeah.
Thankfully, it's not as common as the
Hmm.
others, but yeah, that one has a little bit more of a genetic component. So there's that. If you've had any really bad sunburns as a kid
Hmm.
or in your early kind of childhood where it resulted in blisters, like water blisters on your
Hmm.
skin, you are at much higher risk for skin cancer. If you used a tanning bed more than 10 times,
Yes,
which
I
I feel like
definitely
many
did.
people
Yeah.
have had, that's a risk. If you have more than, some derms say more than 50 moles, some say more than 100 moles, you are at slightly higher risk for melanoma if you have a lot of moles. So that's another reason.
Yeah.
If you're on any medications that could be suppressing your immune system in any way, like people even with psoriasis are on like these injectable biologics, Crohn's disease, like, these can all suppress the
Sure.
immune system and that can increase your risk of skin cancer.
Wow.
So those are like probably the general rule of thumb. If you have like if you can burn really easily, like if you are that fair skinned person with freckles,
Hmm.
red hair, blue eyes, like that sort of phenotype, that look are at higher risk as well. And then some people I will see every 3 to 6 months if they have like more risk factors if they do have like multiple atypical moles, if they've had multiple skin cancers or a lot of pre-cancers. But yeah, basically the list that I mentioned though is for those who should be checked regularly.
Great. Well, gosh, this was so informative today.
I love this.
If you're on TikTok, she's got a great TikTok account. Where are
Oh,
you?
thank you.
You're on all the profiles, is it Dr.
Yes.
Mamia on all of them, or where do they find you?
Yes. Yes. Dr.Mamina, Dr.Mamina on TikTok, Instagram, and YouTube. Yep.
Amazing. Amazing. Is that the best place for people to find you? Is there a website that you want them to go to if they're in your area? And
yes, my website's drmamina.com. I do practice locally. I have a pretty full patient load, so I'm currently not taking new patients. That might change, we'll see. But I have two great partners as well, so you're welcome to like look up my practice and still come to my office, and
follow
you
her
may be
for
able to see
tips.
me.
And follow her for
Thank
tips
you.
too.
Yes.
Thank you so much for today. This was super informative. Thank you.
Thank you so much. I love this. Thank you.